So this video is about how to write an assessment for an inpatient psych note. I think this is kind of one of the harder things to do in psychiatry. It's definitely where the rubber meets the road, if you will, and it's certainly where the art of psychiatry, I think, comes into play as you take really concrete information and adapt it to meet kind of criterias and to kind of present patients' progression through time, you know? So important things to think about with the psych assessment. Who are you speaking to? You're obviously, like all medical notes, talking to the next provider. You're also speaking to any other people who are involved in the patient's treatment, so nurses, social workers, patient advocates. You're speaking to the judge who's making decisions about whether or not a hold should be upheld, whether or not conservatorship should be something that's pursued. These are all part of the audience, and unlike an internal medicine note where you are honestly speaking to an audience of one, you're talking maybe to the next provider is the big one, and you're also just documenting things for the sake of maybe fear of litigation. This is a note that's kind of, it's going to have an immediate impact on patient care because of who's going to read it and how they're going to interpret what you say. So it's a pretty important section. I like to divide it into a couple different subcategories. Let me just open up my notes. And this is all borrowed, I think, from one of the attendings who I worked with this year. So credit really goes to them for breaking it down this way. They encouraged me to first write a differential diagnosis. And this is going to be based off of behavior. So we already talked about doing an HPI and a mental status exam, and that's where the behavior and the symptoms have been listed and described. That day, did your patient display agitation? Did they slam a door? Did they throw one of their medications at the nurse? Did they attend all of their groups and display improvement? Did they begin speaking after several days of catatonic behaviors? That's all concrete evidence, and it's up to you to describe that behavior and take it from just kind of something that like a layperson could document and turn it into like a symptom. So take the behavior, show how that is a symptom of a disease process, describe the disease processes you're considering in your differential diagnosis, and describe what limitations you have for further refining this differential. Do you need more collateral information about timelines from the family? Do you need more information but they are kind of combative and agitated? Do you need more time for the patient to withdraw from drugs before you can get like a kind of true unadulterated sense of their psychosis, etc., etc. The next paragraph or the next sentence or two would be biopsychosocial factors you think that are impacting their presentation. So I think bio is really easy. Organic causes, substances, medications, developmental history, etc., etc. Psycho would be coping skills, trauma, defense mechanisms. And social would be things like homelessness, health insurance, access, familial support, relationships, housing, finances, education, basically everything else. So you can go ahead and kind of describe which of those biopsychosocial factors are maybe protective and which ones are risk factors. And then this should lead to kind of a summatory prognosis sentence. Due to this presentation, due to these behaviors, X, Y, and Z, the phone throwing, the aggression, the unwillingness to engage in treatment process, or the improvement, the increased interpersonal skills, the increased impulse control. The patient is either progressing or continues to decompensate. And due to this presentation, the patient continues to meet their status of GD, DTO, or DTS, gravely disabled, danger to others, danger to self. And then the next thing you're going to do is indicate why this presentation or how this needs to be improved. So the patient continues to meet criteria for treatment at a high acuity level of care, such as the facility that they're currently located at, in order to, and then list the things you need to do to help improve their treatment progression, whether it's in order to continue refining differential diagnosis, in order to continue titrating medications, in order to assess for improved behavioral control, whatever it is that you really do think that they're going to get over the next 2, 3, 15 days, hopefully not 15 days, but it really depends on the patient. What are they benefiting from? Because it's not pleasant to be on an inpatient unit, let's be honest. I think anyone who works in psych is really grateful that we get to go home into our comfy warm beds, and we get to watch TV on Netflix, and we get to, it's quiet, it's safe, it's warm, it's comfortable. So I think the burden 100% falls on us to not only just kind of write like a generic answer for the justification of medical necessity, but really honestly think about, why am I keeping this person here? It's expensive and it's uncomfortable. I need to have good reasons for keeping them, and good plans, good intention of what we're going to do to ensure that by the time that they leave, that this time has been valuably spent for them. Yeah, so I think my goal personally is to write this in about 4 to 5 sentences, and maybe less as I continue to read. I think the old adage, the medical student's note, should be the longest, definitely applies here. Some attendings might get frustrated with you if your notes are too long, and some residents might as well. And in that case, obviously, redact as much as possible. But I think in the early days of training, writing it down can be a good way to elucidate our thought process and help train ourselves. And in that sense, it's completely fine to have a longer note as we train, get more comfortable with the language we're using, and more insightful into how to clearly connect behavior with diagnosis, and diagnosis with justification for medical necessity. The notes will become shorter with time, and we'll just have higher caseloads, so we won't have time to write soliloquies. Yeah, so good luck. I really hope that you have more success in your early days of writing these notes than I did. Don't be discouraged if someone tells you that it needs work, or you're really not making a lot of sense. All criticism is helpful when you're just starting out. There's no better time to be bad at something than at the beginning. That's an adage I hold dear to my heart. And I think we're all beginners, and it's okay to be bad at it as long as you get better. Alright, well, thanks so much, guys. See you later, and I hope you have a good rest of your day.